Breo. This is Fluticasone, and it has ventral. These are 24 hours. So is this, and so is Trelegy, right? They're all once a day. However, one medication, this has two. You've got to rinse after both of these. Why do you have to rinse? Because they have a zone inside. Fluticasone is inside here. You need to rinse off. See the number there? It's going to go down. Do not take your device and tip it over, because then your powder will fall out. You can look and see it right there. And this has no clicking, no shaking. All you do is exhale, and then you take a deep breath in and hold it. Always exhale first, but if you have good breath, you can do it without exhaling. I like to tell you that you should exhale first, because most of you are holding a lot of air inside your lungs and you haven't completely emptied. So give yourself a full breath of very expensive medications, right? And that is the best thing to do. You may taste something. You got to rinse your mouth after, down by one, and you will close it if you're done. If you were unsure if you got everything before you close it, you can and do again, as long as you only opened it once. The number should not move, but once you close it, it's now going to reopen and give you a brand new number, which is what's being dispensed for you to use for that moment. Don't open and close. You will waste this one. Very different compared to these, which you have to trigger, and you will not waste these, because once you open them, as long as you didn't click them, you can close them back up, but not for these. So be very careful. You do need to rinse your mouth after this. You need to rinse your mouth after this one. You do need to rinse your mouth after this one. And lastly, this one. Why? Because they all have a zone inside. Please go and check with your provider. Follow the instructions. And please be consistent. Remember, these are maintenance devices. And if you use them as rescue, they may not work in your favor. And you will not get results. And you're not going to be on the same page with your doctors. Please be careful. Please be consistent, and please follow up, and please check with your doctors regarding your symptoms that remain, such as waking up at night, gasping for air, or frequent use of your rescue inhaler, multiple admission, unexplained chest pain, shortness of breath. Please make sure that you do get a chest x-ray and take care of yourself. Follow up with those doctors. Request a chest x-ray if you must. Take care. This is Dr. Mkono.